A very warm good afternoon to all of you from India. I am Latika Gupta, an assistant professor of rheumatology at SGPGI in Lucknow. I also happen to be the APLAR webmaster and social media editor for several rheumatology journals. Today, we'll be talking about this very important topic on how to conduct research online. Before proceeding further, I'd really like to thank APLAR and the organizers for having me on board today. It is truly an honor to join all of you here. So before we move further, we need to answer 5 vital questions. In fact, maybe just 3 of them as to why conducting research online is important. And what is online research really? And how can you do it? And I hope while we're on the way, you will figure out when to begin and whom you want to do it with. So the why is the usual question which comes up. The typical young researcher problem. I do not have any data. And you feel like you want to drift and float when, as a young researcher, and you want to publish without having that real patient base, which often happens when you are either in a new job or you somehow are unable to collaborate in the immediate environment, do not have patients of your favorite disease, or happen to be in the middle of a pandemic. Or sometimes when you would be based out of somewhere very remote and want to publish and have a research question which you want to answer while transcending all geopolitical borders. Or maybe you're just like me, don't really like paperwork so much and hate the tons and tons of IRB approvals or are fast paced and it would like to do it faster than enrolling real patients would allow, or involved in rare disease research. Then maybe conducting online research is a viable and good option. So broadly, if you look at the kind of studies which can be conducted online, then we could divide them into interview-based studies. There's a surveys, which can be of many kinds, as we'll see in a minute, or analytics, that is big data handling, and the upcoming field of telemedicine-based research. Now, survey-based research can also be of various kinds, including a face-to-face interview with just a few patients, the so-called qualitative synthesis, where it helps you develop broad ideas on a research question, or a case control study, which may be typically cross-sectional, or even much larger population-based impactful surveys, which can be longitudinal cohort studies. Let's go with an example. If you want to answer the question, what are the side effects of the COVID vaccine in patients with autoimmune diseases? How would I begin the study? First, I would design a study, start with ethics approval, start meeting patients with rheumatic diseases in my clinic, which would be 20 to 30 per week, a max of that, or maybe up to 200 some centers in Asia, but still not all of them would enroll. And then maybe go searching for matched healthy controls, which can be quite tiresome and difficult at times. But if we want to convert this into an online study, we design a survey, an online self-report survey. We include with validated patient report outcome measures like PROMIS. We anonymize it. So we just have to seek an exemption from review from the institution review board or the ethics committee, and include collaborators from different locations, include diverse specialties like neurologists, gastroenterologists. After all, we're looking after autoimmune diseases, not necessarily rheumatic diseases, endocrinologists, nephrologists. So what happens with this? The typical advantages are we have a larger sample size. We're likely to gather many more patients, have a wider outreach, and it is a team effort. Definitely lowers costs and is a faster way of conducting research. The other major kind of research is analytics, which can be conducted online. And I devote a few minutes talking about open access data sets, something not many people understand and know about. So these are typically data sets or public use data which are available as anonymized information in various databases for secondary analysis. The advantage of these data sets are most of them are large and they cut down any kind of research costs, as this data is out and out there, available immediately for analysis, and it increases the breadth and scope of your analysis. Further, these are faster, almost immediate means of answering a research question. For example, if we were to visit the University of Tennessee website, then we see so many different data sets. In the health science data sets category, this page goes on and on to describe over 50 different resources for such data sets. And this is just one example. For rheumatology research, there are so many more, like TriNetX, Polifus, MOST, OAI, ORC, DASH, and many more. The National Data Bank is one of the prototype patient-based rheumatic disease registries, which primarily included patients with RA, lupus, fibromyalgia, and osteoarthritis. And this was established way back in the 1970s and has since then been used to develop and validate diagnostic criteria, assess disease outcomes, and the effect of therapeutic interventions and measure costs. Now, the Wolf's criteria for fibromyalgia were also developed out of this data bank, further reiterating the power of such open access data sets. The list of big data sets is endless. Some from the United States are listed here, and many others. If you go to the Johns Hopkins website, you can see a big list of COVID data sets which have emerged out of nowhere in such a short while, and the Welch Library is another very rich resource describing other data sets. Now, suppose we had a different study question. Are myositis patients at a higher risk of tuberculosis? What will be the average time to publication? For a cohort study, it would be 5 years. For a case control study, maybe 3 years. And for a data set analysis, it would be an average of 0.5 years. So, although there are unique advantages to analysis of open access data sets, we have to be aware of the restrictions and limitations. Spend time to understand the data because every data set is different, and attention to detail is very important to end up with meaningful conclusions. This is just one example of analytics-based studies, but there are so many more studies which can be conducted over the internet, like Google Trend Analysis and API analysis, which have been used, like time-sensed and geosensed tweets, and information on Weibo platform in China has been used to predict waves of COVID, just because people started tweeting about cough and fever 2 weeks prior to the outbreak in the locality. Further, there are bibliometrics and altmetrics where the online attention and citations can be analyzed and the factors determining those. And our social media analytics, various databases are full of studies where people have looked at behavioral sciences using WhatsApp analytics, YouTube analysis for identifying misinformation on a particular topic, very important topics like immunization, the misinformation on the internet, and it's very important to curb them. And just like that, people are also looking at Instagram and its impact for education. Apart from that, conventional studies include systematic reviews and meta-analysis. What are the special skills required? One needs to be familiar with social media and online searches, and maybe a decent understanding of statistics, and of course, a thinker's mind is all you require. So in short, for conducting online research, for early career researchers, maybe they could start out with simple things like surveys and case-based reviews. Middle career researchers, gradually you could acquire the skill base and move towards different kinds of online research like a meta-analysis, Cochrane reviews, larger global population-based surveys. And for established researchers, there are other modes of research online, including Delphi exercises, formulating guidelines, and even virtual trials, which we'll talk in a bit. So the future of rheumatology and medicine in general with respect to digital health seems really bright, with a lot of research online being feasible in the times to come in this era of wearables, which can be integrated directly into electronic medical record systems, allowing real-time data sync into these systems, Borderless EMR systems, maybe at some point in the future, we may be able to move to that, allowing a continuous syncytium of borderless care with patients and physicians be interconnected. This would allow for e-consent, a lot of analytics, including behavior analytics, through linkage with social media platforms and triangulation with monitoring for adherence. Everything being electronic from consent to patient-reported outcomes, stored digital archiving, and virtual trials, which will really cut down the time and costs involved in testing newer therapies for different diseases. So this is the real future of medicine. And if you're further interested in knowing about online research, feel free to go to these resources. These journals regularly publish research is conducted online, and this is a very rich repository of open access data sets, and this is for conducting survey-based research. Thank you, and happy to take questions. Also happy to take them on Twitter if you'd like to reach out to me.